Imagine your house has a waste disposal system that clears the garbage every day. And now imagine that the system fails, leading to accumulation of garbage in every room. This is exactly what happens when within our bodies, certain recycling units called as the lysosomes do not function normally, leading to devastating and lifelong disorders called as lysosomal storage diseases. Hi, I'm Dr. Shruti Bajaj, your genetic expert at the Purple Gene Clinic, and today I'm going to take you through these group of disorders in simple language. Lysosomal storage disorders are genetic conditions which occur when the recycling unit of the cell, called as a lysosome, does not function normally. Thus, certain biological material which would have normally got degraded starts getting accumulated in various tissues. It starts getting stored within the liver, in the spleen, the heart, eyes, bones, and even the brain. These disorders can present in multiple ways, but just to enumerate few important red flags, these children can present with enlarged bellies due to enlarged liver and spleen. Sometimes they may have short stature, bony deformities, contractures at the joints. Because of the accumulation of the material in the bone marrow, there could be bone marrow failure, reduced production of hemoglobin, platelets, leading the child to look pale, even having bleeding tendencies. Some of these children may present with delayed development, ADHD, even regression of milestones. So you see, these disorders are often multisystemic, they are progressive and lifelong disorders. The challenge with lysosomal storage disorders is that they are often not detected in time. And the reason for that is that they can mimic many common disorders. For example, mucopolysaccharidosis type 4, the child will have short stature, certain enlargement of the ends of the bones. It can very well resemble a common disorder called as nutritional rickets. We have seen umpteen patients of MPS type 4 misdiagnosed as rickets and being given calcium and vitamin D to a point where vitamin D toxicity occurs, but a diagnosis of MPS 4 does not occur. Individuals with Fabry disease sometimes experience long-standing abdominal pain. A lot of them have erroneously been diagnosed as appendicitis, and their appendixes have even been removed for that matter in few patients. So we see how these disorders can mimic commoner disorders, leading to a delayed referral. And this is of concern because today an increasing number of lysosomal storage disorders are treatable. If treatment is not available, they are at least supportable such that we can reduce the burden of the complications in these individuals. For example, there is now enzyme replacement therapy which is available for a bunch of LSDs, to name a few: Gaucher disease, Niemann-Pick disease, Hunter disease, Pompe disease, and the list goes on. These enzyme replacement therapies actually replace the missing enzyme in the lysosome, which is causing the malfunction of this recycling unit. In some of these diseases, enzyme replacement therapy can actually be a game changer. I remember my training days back when we had given enzyme replacement therapy to these young children. And 20-25 years later, when I follow up and I get to hear their stories, some of them are pursuing their MBA overseas, one of them is married, has a child, the other is pursuing a medical career. So it's actually very heartwarming to see how it can be a lease of life in some individuals. Now there are even oral forms of the drug which are gaining momentum to make the availability of this drug easier. The glitch remains though that these medicines are still very expensive. They are often unaffordable, inaccessible to the very patients who need this the most. There are societies like Lysosomal Storage Disorder Support Society. We have the National Rare Disease Policy along with the Centers of Excellence, which are doing a lot of hard work to help these patients receive these expensive lifelong medications. But the truth remains that the burden of the untreated individuals is still more than the ratio of the patients who are actually receiving this drug. I'm going to share a short story which I think will highlight the importance of a timely diagnosis. A few years back, I had a 4-year-old female child whom we diagnosed with MPS type 4. Now, this disorder can have a complication which we call as atlantoaxial instability. In this condition, the spine can actually slide over itself such that it can even compress the spinal cord, and this can give rise to paralysis. Sometimes it can even be fatal. Luckily for this child, she was diagnosed in time. She underwent a spine surgery, and it's very heartening when her mother shares videos of her running around the house and playing like any other naughty child of her age should be.
4 साल की थी जब तभी हमने डॉक्टर श्रुति बजाज के पास हम गए थे। तो डॉक्टर श्रुति बजाज ने हमको कोई टेस्ट बताया था जिजाऊ का। वो टेस्ट वो पॉजिटिव आया। वो टेस्ट का MPS 4 वो टेस्ट किया हमने। वो टेस्ट पॉजिटिव आया। डॉक्टर ने कहा इमरजेंसी जिजाऊ का और स्पाइन का ऑपरेशन करना पड़ेगा। तो ऐसे में क्या होता है, ये जो बीमारी है, ये बीमारी में बच्चे को पैरालाइज का अटैक आ सकता था। डॉक्टर ने हमको कहा कि इमरजेंसी आप ये ऑपरेशन करवा लो। हमने जिजाऊ का ऑपरेशन करवा लिया। अभी मेरी बेटी डॉक्टर श्रुति के वजह से मेरी बेटी अच्छे से चल रही है, घूम रही है। उनकी दया से मेरी बेटी एकदम तंदुरुस्त है। बस मैं यही कहना चाहती हूँ कि हर कोई का MPS 4 अगर पॉजिटिव आता है तो आप जल्द से जल्द डॉक्टर का सलाह लीजिए और बच्चे की जिंदगी भरा दीजिए।
I think lysosomal storage disorders are what we call as the master of disguise. But if we keep the red flags in mind, patients and physicians alike, we may be able to diagnose these patients in time and offer them a better quality of life. If you find this video useful, please do comment in the section below. Thank you so much.